How did ancient Egyptian women give birth? The terrifying reality before hospitals. In 2001, archaeologist Josef Wegner was excavating a mayor's residence at South Abydos when his team uncovered a single mud brick, unlike any other object ever found in Egypt. Egyptologists had known for a century, from scattered references in medical texts, that ancient Egyptian women gave birth squatting over a pair of bricks. Supported by a goddess called Meskenet, who was believed to inhabit the brick itself at the moment of delivery, no one had ever found one. Wegner's brick, dated to around 1750 BCE, was painted on its upper surface with a mother holding a newborn, flanked by protective goddesses, the sun god disguised as a wildcat, standing guard at the edges. For the first time, a text became an object, and the object made the practice unmistakably real. Women in Middle Kingdom Egypt delivered their children crouched on painted mud, with prayers and a handful of magic standing between them and a death that claimed a great many of them before the birth was even finished. Why birth was a battlefield? Nothing about the danger was exaggerated for effect. Egyptian medicine, sophisticated as it was in treating wounds, setting fractures, and managing chronic disease, had no concept of germ theory, no reliable way to control hemorrhage, and no surgical answer for a birth that stalled. A breech presentation, an obstructed pelvis, or bleeding that would not stop carried the same outcome in the Nile Valley in 1800 BCE as it would have carried almost anywhere else in the pre-modern world. A slow, often fatal crisis with no intervention capable of reversing it. Archaeological evidence bears this out directly. In 2018, a team from Yale University and the University of Bologna, excavating a cemetery at Kom uncovered the skeleton of a 25-year-old woman, dead roughly 3,700 years ago, with the skeleton of a full-term fetus still positioned head down inside her pelvis. So, her own pelvic bones showed an old fracture that had healed poorly, likely narrowing the birth canal enough to turn an already dangerous delivery into a fatal obstruction. Labor had already begun by the time she died. She was found exactly where it had failed her. Modern demographic estimates for pre-industrial societies generally, extrapolated backward from later historical records where actual numbers survive, suggest maternal mortality rates that would be almost unthinkable in a modern hospital system today, with a meaningful share of women dying at some point across their reproductive years from causes directly tied to pregnancy and delivery. Ancient Egypt left no census or hospital ledger to confirm an exact figure, but nothing in the archaeological or textual record suggests Egyptian women were spared the pattern seen everywhere else in the ancient world. If anything, the sheer volume of protective amulets, spells, and specialized medical texts devoted to pregnancy and birth argues the opposite. A society investing this heavily in magical and medical defense against a single category of death was responding to a threat its people encountered constantly, not occasionally. Egyptian physicians could set a broken arm, stitch a wound, and prescribe remedies for ailments ranging from digestive complaints to eye disease, all documented in surviving texts like the Ebers Papyrus, a general medical compendium roughly contemporary with the Kahun text. None of that clinical skill translated into an ability to intervene directly inside the womb. There was no cesarean delivery performed on a living patient, no forceps, no blood transfusion, and no antiseptic technique to prevent the infections that followed a difficult or prolonged labor. A birth that proceeded normally required none of this. A birth that did not had almost nothing standing between the mother and death except time, positioning, and whatever the attending women could manage with their hands. Given that reality, it makes sense that Egyptian women approached childbirth less as a medical event to be managed than as a battle to be survived. One fought with a mixture of practical technique and religious defense deployed simultaneously. on the theory that either one alone might not be enough. The earliest defenses. The concept of a birth goddess embedded in the physical bricks a woman labored on reaches back into Egypt's earliest religious record. Meskenet appears in Old Kingdom funerary texts, already fully formed as the personification of the birth brick and the fate assigned to a child the moment it was born, suggesting the belief long predated its first written appearance. Alongside her stood Heke, a goddess shown with the head of a frog, associated with the final stages of labor and the breath of life entering a newborn's body. And, later, Taweret, depicted with the head of a hippopotamus, the limbs of a lion, and the tail of a crocodile, whose fearsome composite form was itself the point. She looked dangerous enough to frighten off whatever might threaten a mother in the room. Bes, a bow-legged, grimacing dwarf god, completed the household defense, driving off malevolent spirits through noise, dance, and sheer ugliness rather than the quiet dignity most Egyptian gods were given in official art. None of these figures required a temple or a priest to invoke. Amulets carrying their images were everyday household objects, worn by pregnant women and kept near the birthing space itself, a form of protection any family could afford regardless of status. Taweret amulets in particular are among the most commonly recovered protective objects from Egyptian domestic sites of every period, cast in faience, carved in stone, or molded in clay, cheap enough that a poor household could own one without financial strain. Excavators have recovered them in numbers large enough to suggest near universal use, tucked into the wrappings of infant burials, worn on cords around a woman's neck, and set into household shrines alongside other daily protective figures. The sheer physical abundance of these objects in the archaeological record functions almost like a survey result on its own. Whatever else Egyptian families disagreed about across 3,000 years of changing dynasties and shifting fashions in art and religion, the need to keep Taweret close during pregnancy stayed constant. Tomb paintings from private Theban burials of the New Kingdom occasionally show these protective figures in active use rather than as static religious symbols. Painted onto the walls of bedrooms and birth spaces themselves in domestic scenes that archaeologists sometimes call birth arbors, small, temporary structures decorated with images of Bes, dancing girls, and garlands of flowers, apparently erected specifically for the period surrounding delivery. Few of these structures survive as physical architecture, since they were almost certainly built from light, perishable materials meant to be assembled and dismantled as needed, rather than as permanent additions to a house. Their existence is known mainly through painted representations and a scatter of related objects, which means the fullest picture of where an ordinary Egyptian woman actually gave birth remains stitched together from fragments rather than any single complete example. When medicine became a written discipline, belief alone was not the whole system. Sometime around 1825 BCE, during the 12th dynasty, someone compiled what is now called the Kahun gynecological papyrus, the oldest surviving medical document from Egypt and quite possibly the oldest surviving medical document from anywhere. Discovered in 1889 by Flinders Petrie at the town of Lahun in the Fayum, the papyrus addresses fertility, pregnancy diagnosis, contraception, and gynecological complaints in a series of clinical case entries, each one describing a symptom, a proposed cause, and a treatment. This was the hinge point at which Egyptian reproductive medicine moved from purely oral household knowledge into a written professional discipline, copied and presumably taught across generations of physicians rather than passed down only through birth attendants working from memory. One entry describes a pregnancy test that modern researchers have taken seriously enough to test directly. A woman urinated daily onto separate bags of barley and emmer wheat seeds, And if the barley sprouted, the papyrus predicted a boy. If the wheat sprouted, a girl. If neither sprouted, no pregnancy at all. In 1963, physician Pierre Galliongui ran a controlled version of the experiment and found that urine from pregnant women caused measurably higher seed germination than urine from women who were not pregnant, a result now attributed to the higher estrogen levels present during pregnancy, which stimulates seed growth. The prediction of the baby's sex has never been validated and was very likely wrong as often as it was right. But the pregnancy detection itself worked more often than pure chance would allow, meaning a genuinely functional diagnostic tool had been sitting in a Middle Kingdom medical text for nearly 4,000 years before anyone thought to test it. The papyrus covers ground well beyond pregnancy detection. Separate entries address contraception, recommending applications involving crocodile dung, honey, and natron intended to form a physical barrier, alongside entries attempting to treat what the text describes as a wandering womb, an anatomical theory in which reproductive organs were believed capable of shifting position within the body and causing pain, mood disturbance, or breathing difficulty elsewhere, a theory that would resurface independently and with equal confidence. In Greek medicine centuries later under the same basic name, hysteria, derived from the Greek word for womb, Egyptian physicians treating this condition prescribed fumigation, in which a woman sat over a container of burning aromatic substances so the resulting smoke could, in the text's own logic, coax a displaced organ back into place. Modern medicine finds no anatomical basis for an organ capable of wandering through the abdomen, but the persistence of the underlying theory across two unrelated ancient medical traditions says something about how difficult female reproductive symptoms were to explain without an understanding of hormones, infection, or nerve referral. The delivery itself, delivery, when it came, followed a physical logic still visible in Wegener's brick and in the handful of other artistic depictions that survive. Egyptian women gave birth squatting or kneeling, supported by the two bricks, or, in wealthier households, a low birthing stool built for the purpose, rather than lying down, a position that used gravity to assist labor rather than work against it. Attendants, typically other women from the household or trained midwives, supported the laboring woman physically and managed the delivery itself, while a broader ring of family members might remain nearby to assist or simply to bear witness. Ivory wands, curved like a boomerang and carved with rows of protective animals and deities, have been recovered from Middle Kingdom burials and are generally interpreted as tools swept across the floor and threshold of the birthing space to draw a magical boundary against hostile forces, a physical gesture layered directly on top of whatever practical assistance the midwives were providing. No formal Egyptian word for midwife, as a distinct licensed profession, survives in the record the way titles for scribes, priests, or physicians do, which has led most Egyptologists to conclude that birth attendance was learned informally, mother to daughter and neighbor to neighbor, rather than through any centralized system of training or certification. This did not make the knowledge any less real. Experienced women within a household or village would have accumulated, across repeated deliveries, a working sense of normal versus dangerous labor, when to reposition a mother, and when a birth was going wrong enough to call for additional help or more intensive ritual intervention. Expertise transmitted entirely through direct apprenticeship, rather than the written medical tradition the Kahun Papyrus represents. Breastfeeding, too, was managed with the same mix of practicality and formal arrangement visible elsewhere in Egyptian domestic life. Wealthier families regularly employed wet nurses, and surviving contracts specify the length of service, typically around 3 years, along with payment in grain, oil, and cloth, evidence that infant feeding was for at least part of Egyptian society, a negotiated commercial relationship rather than an assumed maternal duty. Weaning itself was treated as a milestone significant enough to record in tomb inscriptions and personal correspondence, marking the point at which a child was considered to have survived the most dangerous stretch of early infancy. Infant mortality compounded the risks already surrounding the mother. Surviving skeletal collections from Egyptian cemeteries consistently include large numbers of infant and young child burials, a pattern consistent with high early childhood death rates across the ancient world generally, meaning a woman who survived her own delivery still faced a meaningful chance of losing the child she had just risked her life to bear. Once the child was safely born, mother and infant did not simply return to ordinary household life. Egyptian custom prescribed a period of ritual seclusion, commonly cited at around 14 days, during which the mother remained apart from the rest of the household, sometimes in a dedicated pavilion erected on the roof or in a courtyard for exactly this purpose. The seclusion carried genuine practical benefit, a recovery period free of ordinary domestic labor at precisely the point when infection and blood loss posed their greatest threat. Even though the Egyptians themselves framed it in terms of ritual purity rather than clinical recovery. The most vivid literary account of a birth in Egyptian literature survives in the Westcar Papyrus, a collection of stories preserved in a copy made around 1600 BCE, but describing events set centuries earlier, at the founding of the 5th dynasty. In it, a woman named Regide goes into a difficult labor with triplets who, the story insists, are destined to become Egypt's next 3 kings. The sun god Ra dispatches the goddesses Isis, Nephthys, Heke, and Meskenet, along with the ram-headed god Khnum, disguised as a troupe of traveling musicians and their servant, to assist her. Each child is delivered in turn, described as healthy, gilded, and fully formed, with Meskenet pronouncing each one a future king the instant he is born. The tale is myth, not medical record, but its premise only works because the audience already understood exactly how frightening and how genuinely uncertain a difficult labor actually was. Nobody tells a story about divine intervention rescuing an event nobody feared. The goddesses in the story do not simply wave the danger away either. Isis, Nephthys, and Heke perform physical actions consistent with real birth attendants, positioning themselves at the mother's front and back and actively hastening the delivery, which suggests the audience expected even a story about literal gods to include recognizable, hands-on midwifery rather than a bloodless miracle. Surviving. While Egypt did not, none of the practical and ritual apparatus described so far depended on political stability to survive. When the Old and Middle Kingdoms each dissolved into their respective intermediate periods, the state's capacity to fund temples, monuments, and royal propaganda broke down, along with central authority. But a woman's need to survive labor did not pause to wait for stable government. Birth bricks, protective amulets, and the attending knowledge of midwives were household-level technology, learned and passed on inside families rather than administered by the state. And the collapse of a dynasty changed essentially nothing about how a woman in a Nile Valley village delivered her child. The core toolkit, physical support during labor, ritual protection invoked through Be'ez and Tauret, and a 14-day recovery period afterwards, appears with only minor variation from the Old Kingdom through the very end of native Egyptian rule. A span of language and religious continuity most other aspects of Egyptian civilization could not match. Royal succession could break down entirely, as it did at the close of the 6th dynasty, when no strong heir emerged to hold the country together, and provincial governors could spend generations fighting each other for local control. But none of that touched the birthing room. The women attending a delivery in a first intermediate period village needed no permission from Memphis to do their work, and no collapse of central taxation ever stopped a family from painting a protective wildcat onto a birth brick. Under Greek and Roman rule, Egypt's conquest by Persia, then Alexander, then absorption into the Ptolemaic and finally Roman world did eventually change the picture, though less by replacing Egyptian practice than by documenting and formalizing it. Ptolemaic-era temples began incorporating dedicated mamisi, or birthhouses, into their architecture, structures where reliefs depicted the symbolic divine birth of the temple's resident god in language directly borrowed from royal birth propaganda of earlier centuries. Though these buildings functioned as ritual and symbolic spaces rather than as delivery rooms for ordinary pregnant women. Greek and Roman physicians who encountered Egyptian practice took some of it seriously enough to record it. The Greek physician Soranus of Ephesus, writing in the early 2nd century CE, described birthing stools and squatting positions consistent with what Egyptian sources described many centuries earlier. Evidence that at least some techniques developed in the Nile Valley had entered the wider medical vocabulary of the ancient Mediterranean world by the time Rome absorbed Egypt as a province. Egyptian religious practice around birth also proved durable enough to outlast Egyptian religion itself in at least one notable form. Bees and Taweret imagery continued to appear on amulets and household objects well into the Roman period, worn by families whose formal religious affiliation may have shifted toward Greco-Roman or, later, Christian belief, but whose instinct to keep a fierce-looking protective figure near a laboring woman had not gone anywhere. Some scholars have traced echoes of the same protective logic, an ugly or frightening guardian figure warding off harm from mother and child, into folk birth customs recorded in Egypt centuries after the old gods had formally been abandoned. Though the direct line of transmission across that much time is difficult to prove with certainty rather than informed speculation. What can be said with more confidence is that no successor culture in Egypt ever produced a safer alternative. Squatting delivery, attended birth, and a recovery period afterward remained the basic shape of Egyptian, then Coptic, then early Islamic-era childbirth for the simple reason that nothing else on offer worked any better. And folk practice tends to persist exactly as long as it keeps outperforming the available alternatives, or as long as no alternative appears at all. The king born of a god, before turning to what modern instruments have confirmed. It is worth remembering how differently Egypt's own state religion told this story, at least for kings, by the New Kingdom. The imagery surrounding birth had been pulled into the highest levels of royal propaganda. At her mortuary temple at Deir el-Bahari, Queen Hatshepsut commissioned an extended relief sequence depicting her own conception and birth as the direct result of a union between her mother, Queen Ahmose, and the god Amun himself, who visited the queen disguised in the likeness of her husband. The sequence shows Amun announcing Hatshepsut's coming greatness to an assembly of gods, her divine conception, and finally her birth, attended by the same protective deities that watched over any ordinary Egyptian delivery, only rendered here at monumental scale and carved permanently into stone. The message was blunt: a woman ruling Egypt in her own right. An arrangement Egyptian political theology had no ordinary category for, required the most powerful justification available, and nothing outranked being the literal daughter of a god. Later, New Kingdom temples, including additions at Luxor associated with Amenhotep III, echoed the same divine birth formula for their own kings, transforming what was, for most Egyptian families, a dangerous and uncertain private event into one of the most reliable tools a monarch had for claiming legitimacy. The gap between these two versions of birth, the monumental and the domestic, is worth sitting with. In one, a queen is impregnated by a god, attended by the full assembly of Egypt's pantheon, and delivers a child described in the accompanying text as radiant and untouched by any of the danger and ordinary labor carried. In the other, a woman crouches on 2 mud bricks in a small mud brick house, surrounded by female relatives and whatever amulets her family could afford, with no guarantee she or her child would survive the next several hours. Both versions were operating in the same country, often within the same generation, and Egyptian religious art never acknowledged the contradiction directly. The royal reliefs borrowed the protective deities and symbolic language of ordinary birth precisely because that language already carried enormous emotional weight for anyone looking at the temple walls. A king's birth was made to look safe by dressing it in the same imagery that, for everyone else, represented a threat. The danger was never edited out of the picture entirely, though even the Deir el-Bahari reliefs include a scene of Queen Ahmose being physically supported during labor by attendant goddesses, a detail that, propaganda or not, still depicts a woman who needed help to get through it. Legacy. What modern archaeology keeps adding to this record is not reassurance. In December 2023, researchers examining a burial at the el-Bagawat cemetery in Egypt's Karga oasis, first excavated in 1908, used CT scanning to confirm that the young woman inside, no older than 17, had died in the process of delivering twins, one still positioned inside her body. She had not lived long enough to become an adult in any sense modern readers would recognize. And she died attempting something her own culture had spent thousands of years building rituals, medical texts, and household gods around trying to survive. Cases like hers and the 25-year-old found at Kamambo are not treated by researchers as unusual anomalies. They are treated as representative, a small, physically preserved sample of a mortality rate that ancient Egyptian texts never recorded in numerical form, but that magical wands, protective bricks, and layered rings of household deities were all, in their own way, a direct response to. Bioarchaeological surveys of worker communities, such as Deir el-Medina, have found death rates among women in their 20s and 30s running well above what would be expected from disease and injury alone. A pattern researchers increasingly read as the fingerprint of childbirth mortality rather than coincidence. The Kahun gynecological papyrus itself remains an active subject of research nearly a century and a half after Petrie first pulled it from the ground. Held today at University College London, where successive generations of Egyptologists and historians of medicine have retranslated and re-argued its case entries as understanding of both ancient Egyptian language and modern reproductive medicine has advanced. Each new pass through the text tends to find another detail earlier translators missed or misunderstood. A reminder that even a document scholars have possessed since 1889 has not finished yielding what it knows. Joseph Wegener's own excavation team continued working the South Abydos site for years after the 2001 discovery. And the broader dig has produced additional evidence of the mayoral household the brick came from. Though nothing that has changed the brick's basic identification as the single physical confirmation of a religious practice, Egyptologists had previously known only secondhand. The birth brick, Joseph Wegener, pulled out of the sand at Abydos in 2001, remains the only one of its kind ever recovered. A single physical witness to a practice that shaped the life, and often the death, of nearly every woman in ancient Egypt. Its painted goddesses, its protective wildcat, its careful border of guardian animals were not decoration. They were the only defense a woman had against a danger her own medical texts could name, but never fully solve. And the fact that so many of these women survived it all, generation after generation, owes less to the magic painted on the bricks than to the women crouched over them, doing what medicine of the time simply could not do for them.